With the massive rise in COVID cases in Kerala, it could just become the COVID epicenter for India. Because amid this surge, Kerala is witnessing also a lockdown now on 31st of July and the 1st of August. Like every weekend, that lockdown on weekend will continue. Kerala, however, is now accounting for more than 50% of the cases reported in India for now. This is becoming a cause of concern. The state is reporting over 22,000 cases for the second day after the 5-day high already registered a day earlier. With 10,000 over daily cases all through the month, a 7-day average of nearly 17,000 cases, Kerala's positivity rate has also now gone up 11%. The centre has decided to rush a 6-member team, which will be headed by Director National Centre for Disease Control, urging meanwhile for adherence to COVID protocol and avoid mass gatherings. Kerala government basically has now come under the target of the opposition Bharatiya Janata Party. They are quick to attack the government specifically over the 3-day relaxations in the COVID restrictions during the Eid festival. That has, according to the BJP, linked to the spike in cases in the state.
The state, once touted for controlling COVID effectively, keeping deaths at a low and sending healthy people back home, is now in the news for all the wrong reasons. Kerala now accounts for 50% of COVID-19 cases in India.
अगर आप देखें कि देश में आज भी चाहे केसेस कंसंट्रेटेड मैनर में पाए जा रहे हैं, लेकिन अभी भी देश में 22 ऐसे जिले हैं जहां पर कि पिछले 4 हफ्तों में हमने एक इंक्रीजिंग ट्रेंड इन केसेस नोट किया है। हमने आपको दर्शाया है स्टेट वाइज ऐसे कौन से जिले हैं जहां पर कि वीक ऑन वीक बेसिस पर अगर हम देखें तो पिछले 4 हफ्तों में केसेस में संख्या में वृद्धि हुई है। यह वृद्धि एक मान लीजिए कि लिमिटेड नंबर ऑफ केसेस से थोड़ी भी वृद्धि है तो यह कॉज ऑफ कंसर्न है, जिसके लिए हम स्टेट से डिस्कस करते रहते हैं।
A drastic increase of cases has been seen in the last 4 weeks. Documents accessed by India Today show Kottayam has seen almost 64% increase in cases in a month. MALAPPURAM has seen a 59% jump in cases. THRISSUR recorded a 45.4% rise during the same period, and Ernakulam has seen a 46.5% increase.
India Today has accessed this letter that has been written by Union Health Secretary Rajesh Bhushan to the Kerala government, talking about the fact that the central team that visited Kerala in the first week of July has made some observations about what really is going wrong in the state. Containment has to be improved in the state of Kerala. This letter also talks about the fact that certain super spreader events have been witnessed in the state of Kerala, which has clearly led to the spike.
In his letter, the Union Health Secretary says Kerala needs to do more in terms of containment. Home isolation cases, currently accounting for 95% of the active cases in the state, need to be done as per the guidelines of the Union Health Ministry. Bhushan also points out that between July 10 and 19, Kerala has seen a spike of 91,617 cases and 775 deaths. The centre says ramping up vaccination and reducing wastage is needed. Higher test positivity of 10.5% may require more stringent measures and restrictions. The centre says another problem in Kerala is non-adherence to COVID-appropriate behaviour among migrant workers. It says some positive patients have refused to get admitted to isolation centres and they need counselling. The centre has already sent a team to Kerala to review the situation in the first week of July. A team is being sent again. With Sneha Modani, Bureau Report, India Today.
So why is it that the Kerala government is really now being attacked by the opposition parties? Why is there a surge and why is it worrying? Number one, high cases may lead to the third wave. Number two, indications are of a possible presence of a new variant, and that perhaps is the biggest worry. Number three, there is a confirmation with regard to low immunity rate that is coming in with regard to communities there. Number four, the state has been lax in restrictions at a time when many other states in northern India are cancelling or postponing religious gatherings or events. We have super spreader events, so to say, that are now being organized. There were relaxations for Bakrid festival. There's the Sabrimala shrine visits of devotees that continues, and that clearly establishes the flouting of COVID safety norms and therefore confirming the less impact of triple lockdown. So the weekend lockdown is in place. Is it enough or is it not? Then we'll wait and watch for the government reaction. In global news, the United States of America is once again leading in the daily number of COVID cases. Despite a large number of US population that has been vaccinated for now, the highly infectious Delta variant appears to be behind the latest round of spike in the US and many other countries. Let's take you through the data. On 26th July, US recorded over 57,000 new cases. India recorded more than 33,000 cases on the 26th of July, which means that the pandemic is still raging. Ensure to get vaccinated, but also to still follow COVID-appropriate behavior. And stand by for now, because after a very short break, we have a special telecast